Hi, everyone. Welcome to It's Worth a Shot for September 13th. We're happy to have you guys join us today. Today, we have a special guest. She's going to be talking to us about enhanced barrier precautions. Let's go ahead and go to the next slide. We have a couple of updates and reminders. We wanted to remind everyone that tomorrow is the National Nursing Home Stakeholder Call. We will send these links out for you guys as well, so you guys can get registered for that call. And then the other one is the COCA call, and it's preparing for the upcoming RSV, influenza, COVID, all those vaccines for older adults. For those of you guys who reviewed the ACIP recommendations, they did determine who's going to be eligible for the COVID vaccine. So hopefully we'll get the CDC approvals in the upcoming days for that. So more to come on that. Let's go ahead and go to the next slide. So as always, just a couple of reminders. We do have an evaluation that we will send out. Thank you, Mary. She just plugged that into the chat. We appreciate you guys' feedback and ideas for upcoming webinars. So let us know your ideas. We like to be able to meet you guys' needs. Let's go ahead and do a quick polling question. So today, our question is, does your nursing home and hospitals have care coordination meetings together? Right, lots of good answers coming in. I'm happy to see that the yeses are outweighing the no's, so that's good. Give it just one more second. All right. Yeah, it looks like a lot more yeses than no's. As always, we can share the results. If you guys need assistance with that, reach out to your account managers. We're more than happy to help with care coordination and setting up meetings however we can assist. So thank you guys for participating. Let's go ahead and go to the next slide. So just some updates on our COVID numbers. You can see that our number for hospitalizations has kind of starting to level off a little bit. I think we were at about 17,000 last week. We're at 18,000 this week. Unfortunately, our deaths is still on that upward trend, and our vaccinations still seeing some increase there. Let's go ahead and go to the next slide. And you will see our friends in Alaska have been completely swarmed by the orange, which means that there's been a substantial increase. There's a couple of more patches that are popping up over Montana and a few in the northeastern corner of Wyoming, and I think a little less actually in Hawaii. So keep watching for those COVID numbers. Let's go ahead and go to the next slide. And I would like to welcome Erica Baldry. She comes to us from the Montana Department of Public Health and Human Services. And today she's going to talk to us about enhanced barrier precautions and understanding the why and the how. So welcome, Erica. Thanks for joining us today.
Awesome. Thank you. It's good to be back. I think I presented on enhanced barrier precautions back in April, and so I'm taking a little bit different of approach this time and really trying to talk about the why behind enhanced barrier precautions. So as mentioned, I'm the Healthcare Associated Infections and Infection Control and Prevention Section Supervisor for the Montana DPHHS. Next slide, please. All right, so we have a couple of key points here for you today of things that I really want to hit home with you, and hopefully I'll reiterate throughout the presentation today. But multi-drug resistant organism, or MDRO, transmission is common in skilled nursing facilities, which contributes to substantial resident morbidity and mortality, as well as increased healthcare costs. And we'll talk a little bit about some of those healthcare costs towards the end of today's presentation. Two, enhanced barrier precautions, or EBPs, are an infection control intervention that were really designed to help reduce transmission of resistant organisms, especially in our long-term care settings. Number three, enhanced barrier precautions may be indicated for residents with any of the following. So historically, we implemented enhanced barrier precautions for individuals who were colonized or infected with an MDRO. The updated guidance now states that it is indicated for residents who have wounds or indwelling devices, regardless of their colonization status, infection, or colonization with an MDRO. So there are a couple of things that, and we'll work through these examples. I'm going to have you guys participate towards the end of the presentation today, where we're going to talk about when would you apply enhanced barrier precautions, and then when would you apply other types of transmission-based precautions. Number four, effective implementation of enhanced barrier precautions requires staff training on the proper use of personal protective equipment, availability of PPE, as well as hand hygiene supplies at the point of care. And then finally, and you'll see this on a bunch of my slides, standard precautions continue to apply. Next slide. So today's presentation, I really want to focus on colonization as well as our multi-drug resistant organisms. Here in Montana, we do see multi-drug resistant organisms. Typically, we see about 1 to 3 carbapenemase producing organisms a year. And I think that other states joining today's call are in about the same similar boat when I talk to your HAI program coordinators. However, what we're finding is that more than 50% of nursing home residents may be colonized with an MDRO. And so a lot of times when we're talking about colonization, we talk about this glacier image, right? That or this iceberg image of part of it, what we're seeing, those that we know are colonized or those that we know are infected are that top piece right above the water, right? And then we look at the rest of the iceberg, which is below the water surface, and we don't know about those cases, or we don't see them. The definition of colonization is an individual that is carrying an MDRO or in or on them, but they do not have symptoms of infection. So we do have individuals that can be colonized, but they are not showing symptoms of infection. However, some colonized people will eventually develop infections. And so that's our concern, especially if individuals become symptomatic, develop severe infections, and we don't have a lot of options to treat those individuals. Colonized people can be a source of spread for MDROs to other people in healthcare settings, right? So if we don't know they're colonized with an MDRO, they can very well spread it very easily. And this is why enhanced barrier precautions are so important, because this is one of the tools that we have in our infection control toolbox to really help mitigate the spread of MDROs within this setting type. We know that nursing homes have been the setting of many multi-drug resistant organism outbreaks. And when they do result in resident infections, we have very limited treatment options because, once again, these are multi-drug resistant organisms, meaning they're resistant to a lot of the antimicrobials or agents that we typically use to treat these types of infections. Next slide. Here are some examples of multi-drug resistant organisms. Some of these may sound familiar to you, some of these may be new to you. And some of the multi-drug resistant organisms that are targeted specifically by the Centers for Disease Control and Prevention include pan-resistant organisms. A pan-resistant organism is an organism that's resistant to all antibiotics. Carbapenemase producing, carbapenem resistant enterobacterals. So sometimes you'll hear these referred to as CPOs or CPCREs. We also have our carbapenemase producing, carbapenem resistant Pseudomonas species, carbapenemase producing carbapenem resistant Acinetobacter. So sometimes these are called CRAB. And then finally, Candida auris. We have not had a case of C. auris here in Montana. However, more states are identifying C. auris. So do keep an eye on this as this is an organism that is spreading throughout the United States. There are some additional epidemiologically important MDROs, MRSA, which I think we all know, very familiar with, especially the long-term care setting, ESBLs, VRE, multi-drug resistant Pseudomonas, as well as drug-resistant Streptococcus pneumoniae. So each state health department should have a list of reportable conditions. Here in Montana, we have both a reportable conditions list as well as a confirmation of disease list. So I would encourage you to check with your local public health or your state public health as to what's reportable. Next slide. All right, so I just kind of wanted to show a little bit about how transmission can occur within the healthcare setting. So if you have an infected patient, the image on the top left corner, and so you have a healthcare worker's hand who provided care to that individual, and then they go and care for that individual's neighbor, right? And so we can have spread of infection that way. Another way is maybe we're using some medical equipment, right? And we take that medical equipment, we don't clean and disinfect it between residents, and we take it into the next resident's room and we use it on that same resident. And so then there are some ways, though, that things we can do, and I'm sure you're already thinking of these to help prevent transmission. So just as a heads up, there's a lot of images on this one. So if you want to press enter a couple of times. Okay, perfect. So in this first scenario, if we have an infected individual, one thing that we can do is to perform hand hygiene as well as wear gown and gloves. And that's what we're really focusing on with our enhanced barrier precautions. This helps to prevent transmission. You want to press enter again. And then you'll see that we're able to stop that chain of transmission. Now let's look at the bottom example. Press enter. Let's say we take that cleaning equipment or that medical equipment, and we use a cleaning and disinfectant product that's approved by EPA, and we now use it on our next resident. So press enter and enter. And we don't see spread this way. So things that we can do, very fundamental things that we can do to help stop the transmission of multi-drug resistant organisms as well as other pathogens within our healthcare settings are to perform hand hygiene, and with enhanced barrier precautions, that's wearing gown and gloves. Also making sure that we're using an EPA approved product for cleaning and disinfection. So if we're only focusing on residents with active infection, we fail to address the continued risk of transmission from residents with MDRO colonization, because once again, we don't always know who is colonized with an MDRO. Next slide. So one question I get a lot is, well, why don't we just use contact precautions then? And contact precautions are one type of transmission-based precaution used when pathogen transmission is not completely interrupted by standard precautions alone, right? Standard precautions are things that we're doing every single day to help prevent transmission of infectious agents. Contact precautions are intended to prevent transmission of infectious agents such as MDROs that can spread via direct or indirect contact. It does require the use of gown and gloves on every entry into a resident's room. So I'd like to highlight the word every there because we're going to talk about enhanced barrier precautions. The resident is provided dedicated equipment and placed in a private room. And since room restriction is required for a patient on contact precautions, it's generally intended to be time limited. And when implemented, we really should have a plan when we can discontinue that or de-escalate that. Next slide. So another question I get is, well, why does CDC now recommend that we use enhanced barrier precautions for individuals with indwelling medical devices and wounds, not just infected individuals? And once again, we want to think back to that iceberg picture, right? We only really know about a small percentage of individuals who are truly infected or colonized with an MDRO. And so it can be really hard to routinely identify these individuals. Nursing home residents with wounds or indwelling medical devices are at an increased risk of both the acquisition of an MDRO, but also becoming colonized with it. And then examples of indwelling medical devices can include things like a central line, urinary catheter, feeding tube, trach, ventilator. Next slide. So now we have enhanced barrier precautions. And this, CDC came out with this because contact precautions really seem to create challenges for our nursing homes. We were trying to balance the use of our personal protective equipment and room restriction to prevent MDRO with the overall residents' quality of life. And once again, contact precautions, is meant for a specific duration of time with the option of de-escalating or taking that person off contact precautions. One of the issues with our MDROs is we don't know how long individuals can be infected or colonized with them. Therefore, if we put them on contact precautions, they could be on contact precautions restricted to their room for a really, really long time. And that has a huge impact on our residents' quality of life. So enhanced barrier precaution really expands the use of personal protective equipment, and it refers to the use of gown and gloves during very specific high contact resident care activities. And so this is where we're going to be wearing specific PPE for specific residents within our healthcare facility for specific activities. And those activities are actually listed on the enhanced barrier precaution sign from CDC, which is at the end of this presentation. And then the consideration to expand enhanced barrier precautions as a routine approach to infection control is really based on recognition that standard precautions often have not been successfully implemented in our nursing home settings. And so there have been missed opportunities when we should be wearing PPE or personal protective equipment and we haven't. And so we've really tried to outline when we should be using PPE, when we should be taking these extra enhanced barrier precautions. Next slide. I wanted to take some time to talk about implementation, right? So we're talking about enhanced barrier precautions, what they are, when to apply them, but how do we implement them? And the first step is really to train our staff on how to implement them, when to use personal protective equipment, what PPE to wear. But with that, and a lot of times when I'm teaching about infection control, I talk about you need to make sure that the PPE is available, that hand hygiene products are available, right? We don't want to create barriers to using and implementing enhanced barrier precautions. Implementation of routine enhanced barrier precautions would incur costs, including PPE, training staff time to don and doff PPE, as well as signage materials. However, there was an economic analysis of a randomized trial involving the use of enhanced barrier precautions in a bundle to help prevent catheter-associated urinary tract infections, or CAUTIs. And there was an estimated net savings of approximately $15,000 per year per facility. And so taking these extra precautions helps us to prevent infections later on, which also require additional PPE, which also require additional medical care and additional medical costs. Next slide. So this is a table that I really like to refer to whenever I'm talking about enhanced barrier precautions versus standard precautions versus contact precautions. When do you use them? How do you use them? And so I think this is a really nice visual, and I'll talk about another resource that was recently developed that you'll find helpful, hopefully. But this talks about, when does this apply? What PPE do we use? What is the required PPE and room restriction? And you'll see with enhanced barrier precautions, a really big difference between enhanced and contact is enhanced barrier precautions does not require room restriction. However, contact precautions does require that room restriction. So once again, we're trying to find that medium ground of the resident's quality of life, but also mitigation of a communicable or infectious disease. Next slide. All right, determining enhanced barrier versus contact. So walked through a couple of scenarios for you. So if the resident is known to be colonized or infected with an MDRO, then we would implement enhanced barrier precautions for those individuals. Now, there may be some circumstances when public health is saying, hey, you know what, we're going to use contact for now. Maybe it's the first case of CORS in the state, in a facility, and we really want to take the time and the public health response to make sure we're mitigating the spread of that. Does the resident have a draining wound that can be contained? The big thing here, it can be contained. If yes, enhanced barrier precautions for the duration of stay or until that wound heals, as long as they're not also colonized. Does the resident have a wound that can be contained with dressings? Then that can't be. apologies, can't be contained, then contact precautions, right? Because there's that increased risk of spreading the infectious agent. And then does the resident have an indwelling medical device? If yes, enhanced barrier precautions for either the duration of stay or until that device is removed if they are not colonized with an MDRO. So once colonized, enhanced barrier precautions, most likely for the rest of the duration of stay. But with wounds and indwelling devices, you could change their status based on if they have an indwelling device or a wound. Next slide. I wanted to touch on the difference between enhanced barrier precautions and standard precautions as well. And as many of you know, standard precautions apply to the care of all residents and the use of PPE based on anticipated exposure to blood, body fluid secretions, or excretions. Enhanced barrier precautions expand the use of gown and gloves beyond anticipated blood and body fluid exposures, and they really focus on using this personal protective equipment, once again, gown and gloves, during high contact resident care activities. Now, standard precautions still apply when we're using enhanced barrier precautions. So, for example, if I'm doing an activity where there may be splashes and sprays, but this patient is on enhanced barrier precautions, I still want to use my eye protection, right? I still want my mucous membranes protected. So they're going to play together and you're going to use them to complement one another based on the activity you're doing. Next slide. All right, so I am going to ask for your guys' help, so please use chat. I love getting participant involvement when I'm presenting. So the first case scenario I have is name that precaution. So you'll type either standard, enhanced barrier, or contact. You also could just put S, E, B, or C, whatever makes your life easiest, okay? So case number 1. You have a resident who is admitted to your facility on September 13th, 2023. They are admitted with a wound on their elbow that requires a dressing due to it continuing to drain. The wound can be contained with a dressing. What precaution should this resident be placed on? Kirsten, you are so good. Good job, everybody. Good job. Okay, so can you press enter, please? They're getting this one. So enhanced barrier precautions because we have a wound. And then remember, standard always applies. All right. So can you press enter? Thank you. Case continued. 2 weeks later, the resident's wound is healed and no longer requires a dressing. The resident now has an indwelling urinary catheter. What precautions should this resident be placed on? Good job, good job. I'm going to press enter. Everybody's doing perfect. And that is enhanced barrier precautions because now we have an indwelling medical device, right? We have an indwelling medical device here. And then once again, standard always applies. All right, enter one more time, please, for me. All right, 1 month later, the resident's urinary catheter is removed. They have no wounds, no indwelling medical devices, and they are not known to be colonized with an MDRO. What precaution should this resident be placed on? You guys are so fast. All right, you want to press enter for me? Good job, everybody. All right, next slide. Okay, case number 2. You have a resident who was admitted to your long-term care facility on September 1st. You received the interfacility transfer form. If you need an example of that form, let me know. I will send it out to you. From the admitting acute care hospital, you see that MDRO is marked. This resident tested positive for a KPC positive CPCRO on August 30th. This resident also has an indwelling medical device. What precaution should this resident be placed on? Okay, so I'm seeing a little bit of mix here. So if you want to press enter, and this, you guys are right on this, that this could be a mix, because this will depend on your health, on your public health agency. Can you press enter? Perfect. So enhanced barrier precautions, unless otherwise directed, right? There may be times where public health is saying, hey, I think contact precautions make sense for this individual because this is a KPC positive CPCRO. We haven't seen this before. This is the first time your facility is seeing this. You know, contact precautions may be applicable. or enhanced barrier precautions if this is something that's a little bit more common in your region. So it's really going to be region specific, public health specific. Next slide. Oh, sorry, thank you. Case continued. 3 weeks after admission, the resident's indwelling medical device is removed. What precautions should this resident be placed on? So no indwelling device, but remember they still have the KPC, CP, CRO. Beautiful, beautiful. All right. Can you press enter, please? Enhanced barrier precautions due to colonization. So remember, sadly with these MDROs are carbapenemase producing carbapenem resistant organisms, as well as other MDROs. Individuals are typically colonized for the rest of their life. We do not have a great way for at least carbapenemase producing organisms at this time for really testing if they are no longer colonized. There have been studies where they have tested, 50 days, 100 days, and with Seoris, and then 500 days out, and they maybe were negative on day 100, but now positive again on day 500. So it's really important that individuals that have, Seoris or these carbapenem resistant organisms or carbapenemase producing organism, they are most likely going to be considered colonized for the rest of their life. Now, guidance may change on that. We may get more information. We may be able to get more research on that. But for right now, that is what the CDC is recommending as part of what's called the MDRO containment plan. All right, next slide, please. Last example, thanks for hanging in there with me. Case number 3, your facility has a resident with a wound infected with group A streptococcus on their face. The wound is unable to be covered or contained, and it is currently draining. This individual is also known to be colonized with MRSA. What precaution should you place this resident on? The big thing here is this wound cannot be contained, okay? So if this wound can't be contained and we're potentially spreading this, what precaution? Good job. I'm seeing lots of contact. Can you press enter, please? So the recommendation here is contact because that wound cannot be contained, okay? So we have that really high risk of spreading to other residents. And then once again, standard always applies. Next slide, please. Or press enter, thank you. A few weeks later, the individual's wound is healed. What precaution should we now place this individual on? And remember, they have MRSA, so they're colonized with a known MDRO, but the wound's healed. Awesome. All right, if you want to press enter here. So it's enhanced barrier precautions because they are colonized with MDRO, okay? So once again, colonized with an MDRO, you are on enhanced barrier precautions. The wound, if it's healed, or it can be contained, is enhanced barrier precautions. If this individual did not have MRSA, they just had a wound. Once that wound is healed and they don't have a colonization with an MDRO, they could be taken off in standard precaution. So this is where you need to kind of look at, what is their MDRO status and check off. Do they have an MDRO? Yes, no. If yes, they're going to be on enhanced barrier precaution. So I hope I'm explaining that clearly, but please, please, please let me know in chat if you have questions about that. All right, next slide. Next and final slide. So here are some resources that I wanted to share with you. So there is a nice infographic on CDC's website, and there is a link to these sources on this slide of how we keep our residents safe. So it talks about what's new, why we're making these changes. It has a picture of the enhanced barrier precaution sign, and you'll actually see, on that sign is listed the activities that staff should be wearing gloves and gowns for. And then the second one is, enhanced barrier precaution steps and when we should use it. So indwelling medical devices, wounds, colonization. And so just some resources. I wanted to make it easy for you all to find. And that is all that I have. So I think I made time, but one final announcement is Mountain Pacific worked closely with us. Sorry, that one's on another page, but this is just a pocket guide. Mountain Pacific and I worked together to create a enhanced barrier precaution versus transmission-based precaution kind of quick cheat sheet for you so you can see what the difference is when do you apply it. And so I think that link is oh, perfect. They've already uploaded it. Thank you, Callie. So go check that out. Give us feedback. Let us know if that helps to make things a little bit clearer. I know it's really confusing when we're talking about all these precautions. So hope that this helps. And it looks like we have a question. When you start the EBP, can you discontinue it down the road? And the answer is yes, depending on the situation. Okay. So if you started the EBP because of a wound and they are not colonized with an MDRO, you could take them off of enhanced barrier precautions once that wound heals. However, if they have a wound and they're colonized with an MDRO, even if that wound heals, they're still on enhanced barrier precautions because they are colonized. And for the most part, depending, Callie, on the organism. So MRSA is a little bit different when we're talking about colonization and infection and effective antibiotic therapy. Most of the time, we're talking about C. auris, our carbapenem-resistant organisms, our carbapenemase-producing organisms. Those are individuals we are assuming they are colonized even with effective antibiotic treatment because, once again, we have not been able to get the data that really shows clearance of these. There have been some studies that they've conducted where an individual may test negative and then test positive, within a couple of days or a couple hundred days. And so individuals sadly can be colonized for a really long time with these MDROs. And that's why it's such a big deal.
Okay, thank you for answering that, Erica. And Kelly, as far as the pocket guide goes, I'll have to follow up on that. I'm not sure, but I can email you back and follow up on the pocket guide. So, all right. Well, thank you again, Erica. Everyone, please take a minute to fill out the evaluation in the chat. Again, we appreciate your feedback. So let us know what you guys would like to see in the future for upcoming trainings. So have a great day, everyone. Thank you.